Thank you very much for this excellent presentation. We have Marcela. She's been working on this for 30 years and has been very active for 5 years. She represents the people with HIV in Argentina and for 10 years has been part of the Latin American and Caribbean movement. And she's part of the counseling. Also, Maria Lucila Esquivel. For those of you who know her, we know her as Lucy. She's founder and current president of Unidas en la Esperanza. This is an association of female sex workers in Paraguay, and she also forms part of the Retrosex as she's responsible for information and training of the network. I'd like to open up the panel based on the presentation of Javier, asking you how these structural barriers that were evidenced during the COVID pandemic affected your communities in particular, and what your organizations did to respond to that. Marcela? Okay, okay, thank you. It's good to be here with everyone. Thank you very much for this invitation and to continue including this topic on the agenda. Undoubtedly, COVID showed a fragility in health that apparently were forgotten, including public health. It seemed that everything was resolved, and when COVID arrived, we saw a huge fragility. Undoubtedly, we responded rapidly for urgent problems, but it wasn't the same response for this on the part of the systems. One of the strongest points we saw, and undoubtedly I would like to mention, because apparently this is something very simple, but it is a serious issue, is that the disarticulation of the programs. When COVID hits the infectology system, people don't know where to go, what to do, and nobody was providing an answer. The strategies that we adopted as a civil society were a lot faster to see how we could deliver medication, what was happening. When one of the points was, how can we access treatment? What is happening socially? And how do we, because a lot of people were living alone. A lot of them had no way to respond to different situations that were arising. Over half the people, you know what they were asking for? Food. They weren't even asking for treatment. And this shows the social inequality in Latin America and the Caribbean. This inequality that apparently is invisible, they don't see it. And this discrimination when we're asking for food, we had to say, oh, if you lived with someone with HIV or you had HIV, you live with HIV or not. From the social civil society trying to set up a response with the programs. So I think COVID has been a great opportunity to see a hidden reality. This is what we have to show. We have to pull it apart so we can have, when we talk about comprehensive, I mean, out of my own voice, I think it doesn't exist. A lot of speeches, a lot of programs, a lot of things written, but when it comes down to brass tacks, this comprehensive service, it doesn't exist. People with cancer who didn't know where to go for therapy, programs that had to do with a lot of things, they were disintegrated. And of course, the antiretroviral medication. Thank you, Marcela. Thank you. Thank you, Marcela. Lucy, what happened in Paraguay? What happened in your organization? Yes, first of all, thank you very much for the invitation. Good afternoon to all of you. I just want to mention that we are in a forum of stigma and discrimination, and my partners were not able to enter because the they had problems with the access to the link. So I just want to clarify that. So my colleagues weren't able to access. The other thing is to mention that the pandemic clearly uh, became all the problems we were seeing as social workers became visible, as well as the absent state in the life of sexual workers. And the pandemic, stigma and discrimination, this is one of the worst pandemics of our lives, even way before HIV and COVID. Social assistance never arrived for our colleagues. Having to stay at home for sexual workers was a problem because, based on that, police was exerting a lot of force. We weren't able to work. And therefore, many of my colleagues today are homeless, and the only help that they received was through ourselves, through friend, uh, allied organizations, and also the network that destined some funds to be able to purchase first necessity items, food, and with those things were the ones that we sent to our partners or friends, colleagues. But from the state, nothing, nothing, including masks, bleach, and other things that had to be used to put all this in order, the protocol that the government was implementing. So for us, this was really a learning curve and very major for the sexual workers, because the sex workers, because we could see how we could help our colleagues around America. The Retro Sex Network moved, and as well in Paraguay, for this humanitarian aid. Thank you very much, Lucy. Javier has mentioned some challenges for the future and some actions that we have to think about. COVID has also dismantled our health systems and reduced budgets to respond to HIV and other health issues, to dedicate those to COVID. And some of our countries are still trying to see how this has been reduced. What actions would you propose? And this is a question for all three of you. Go ahead. What do we have to do to respond to HIV? Take this up again and eliminate stigma and discrimination towards the most affected communities. Marcel? The truth is, as a civil society, once again, we have to set everything up again. Can you hear? Probably because as a civil society, once again, we have to set up another response, and that as associations of civil society, we be the center to see how I think the states themselves are all dismantled, and this stigma and discrimination is growing more and more in the different communities. And COVID came to once again highlight this that was being seen in the entire region and that we had been feeling. I want to take up a topic about the vaccination here in Argentina, but also in several countries in the same region. We see that you have to get a positive diagnosis to enter within vulnerable groups. Some things that we had already resolved, once again, they are on the table. And this answer has to be comprehensive. Talk about comprehensive in a health system. And we know, of course, all of us who are here, it doesn't have to do also only with dispensing medication, but the programs unify the response in the programs. It's incredible that after 40 years of HIV, we still don't know about reproductive health with the HIV programs, for example. This is just an example. So I think that it's the health systems are very fragile, and we have to focus on that and talk about that because it's not going to work. That response, if it's not articulated, if there are no resources or joint policies between the civil societies and the programs. Thank you very much, Marcela. Lucy, go ahead. Well, the great challenge for us is still the regulation of our work. If they don't see us as people who, as persons who have rights, the public policies are not made up for sex workers. We need a law for sex workers and urgently review those things that are trampling on our human rights, and to stop think that we are a vehicle of transmission, and not that we are women who have rights. And I think it's time for the states, the entire society, realize that we are women who were not asking to be recognized or approve them, for them to approve us. Simply respect and honor our decision to work as sex workers. Thank you very much, Lucy. You have to activate your microphone. Quickly, I wanted to mention, because I've already talked a lot, so I would prefer my partners, colleagues, to be able to answer. We don't have to underestimate the COVID crisis has proven that it's a matter of class and access to resources, access to many things. There was a speech in the media about telemedicine, children who went to class on their computers at home, telework. That is a minority. That is a minority in Argentina, from Argentina to Mexico. This is an area with most inequity. So talk about teleeducation or remote working or schooling or whatever is for a minority. All of us who are we don't have to feel guilty for all that, but we have to remember the first lesson learned doesn't have to do anything to do with HIV. The state, as Lucy said, a lot of workers who were fired, unskilled, and a lot of that is double vulnerability. And also, the abolitionists have taken advantage of this to speak into the ears of the minister not to go and do something to provide subsidies to sex workers, because it would be a precedent post-pandemic. And so this is a cross-sectional issue, and we have to be able to achieve 95, 25 in 4.5 years. We have to achieve our goals, and that is very difficult, a lot more difficult than a vaccine for HIV. And as you say, it's the cost of opportunity. Once the pandemic is over, because sometimes we talk in a past tense, and we're in the middle of the pandemic, but maybe we'll have a bit of vacation because of the heat and vaccination. But we see that in the north, the second, third, and fifth wave are on there. And so what we have lost as far as prevention, treatment, people who have died due to complications related to AIDS, and again, to recognize and charge the governments for the importance when the health system, public health system failed, the community centers were the ones who responded, and it includes the community service. And so now we have an opportunity to charge them, say, hey, you need to invest in these community services. Thank you. Thank you very much, Javier. Yes, in the pandemic in certain countries has removed this strengthening of community services, sustainability, hiring with the state, etc. But the public is uh, addressing the other side of the coin. Why leave this in the hands of the civil societies? It's a burden, but we should demand from the state itself. So request or recommend from the states. I would change that verb as tell the states to comply with their responsibility. So it's these civil society are not overburdened about social protection. Lucy, you now. We agree. We have to demand all our governments throughout Latin America to comply with us, everything that they owe us. But unfortunately, at least I can talk about Paraguay. We have a state that is doubly hypocritical with a moral change that is huge, and we are not recognized as people who have rights, and not only sex workers, but the entire population. Imagine that Javier was mentioning vaccination. If you think of workers and how we are exposed, they should think that we are a highly vulnerable population to transmit COVID. They didn't even take that into account. So if we hadn't been on the corners, in the street, to look out for our colleagues, nobody would have done it. I think that they do have a commitment and a responsibility towards us. But unfortunately, we have a state that's empty, void, double moral standards, and that don't acknowledge us. And they prefer to keep us invisible, and we cannot give up. We have to keep trying to make our governments see that this population exists and that they have needs, emerging needs. And remember that the Amnesty International, Lucida, were calling on governments to attend to our necessity, to our needs. Colleagues, to date, they have not done it. So the second wave, the third wave is arriving, and here we are. We're still here because there is no response. We have to continue being there and being strong. Thank you very much, Lucy. Marcela. Well, we could keep listening to the fact that COVID is an excuse for anything. No money due to COVID, no education because of COVID, no work because of COVID, and no response because of COVID. And this is what we have to do. The state must, as a human right, respond to the human beings, to health, to education, to food, all the rights that we have in each country. And I think this excuse that the states keep using is something that we have to eliminate. There's responsibility here, and it's not up to the civil society. The civil society should demand respect for our rights. Not that we have to go out and deliver food because people are dying of hunger. COVID would still be amongst us, and the response should be a state that is made up of a responsible policy, a strategy, a well thought out strategy, not things that they're studying going to do, just because. A lot of countries would go respond depending what they thought of that day. There was no strategy. It wasn't set up with a public policy, well thought up, with a budget, with people, with planning. Yeah. So that's why we give better responses. We
have analyzed that strategies and surveys have to be designed jointly based on what was the situation. Apparently, this is not being understood yet. So we have to ask for this to be implemented because this will go on. You see, Argentina today, uh, well, we have a situation. Some countries feel that COVID is over, and I still today miss so many friends who have died because of COVID. So I think we should not put our guards down. We have to demand the rights. We have to be really alert as a civil society. We have to be alert to the requests, the demands, and make sure our rights are not violated. We have our implementing campaign on violence, gender violence. How many things have happened because of COVID? But this is not something that arose because of COVID. This was among us already. So this is one of the failures of public policies. We have to request this to become a public policy, but with as a state responsibility and not as civil society. Thank you. Thank you very much, Marcela. We have 1 minute 20. And I would like to ask you if you could demand an action, request for an action in an immediate future. We have quite an array of different kind of representatives in this. What should be the immediate action we should implement to overcome these barriers set up by COVID in the region? Well, I believe that the action, I will take something from Lucida. I have to say that it's putting the voice of the civil society in the center of the response. This is something that we have heard many times, but this is not done. If we could implement public policies with the voice of civil society, with the experience, and especially with the strategies, the answer would be different. Thank you, Marcel. Lucy. I fully agree with what Marcela just said. You have to adopt the strategy from the populations, all strategies that have really proven an impact through key populations, through us, through ourselves, through all the populations, not only sex workers, sexual workers, all the populations, because they are the ones that gave good results. So we have to be listened to. We have to put all the lessons learned into practice. Thank you very much, Lucy. No more time left. I want to thank you very much, Javier, Lucy, and Marcela, for your availability and for sharing your experience with you. Big hug and take care. Thank you.